Bismillahirrahmanirrahim. Assalamu alaikum everyone. This is Dr. Mubasshra and today I want to discuss with you a very important topic, that is secondary diabetes mellitus. Diabetes mellitus is a group of metabolic disorders characterized by high blood sugar level over a prolonged period of time. Insulin is the principal hormone made by beta cells of pancreas that regulates the uptake of glucose from the blood into most of the cells in the body. The deficiency of insulin or insulin resistance, that is, inability of body cells to utilize insulin, is the major cause of all forms of diabetes mellitus. So, what is secondary diabetes? It is a rare type of diabetes mellitus which is not directly caused by insulin deficiency or insulin resistance. It is secondary to some other medical conditions. Secondary diabetes is also known as type 3C diabetes. So, what are the conditions which can lead to secondary diabetes? These may include endocrine disorders, genetic disorders, and certain medications. So, first of all, endocrine disorders which lead to secondary diabetes. These include Cushing syndrome. Cushing syndrome is a disorder in which body makes excessive amount of cortisol, and since cortisol regulates blood glucose level, hence due to excessive cortisol there is disturbance in the blood glucose levels. Then another important cause of secondary diabetes, acromegaly. It is a condition in which there is excessive growth hormone. It causes excess glucose in the blood and causes insulin resistance. Pheochromocytoma is a catecholamine secreting tumor which is another cause of secondary diabetes. Then there are certain genetic disorders, for example, myotonic dystrophy, hemochromatosis, and hemosiderosis. Hemochromatosis is a disorder in which there is extra iron which builds up in the body. It can damage pancreatic beta cells and hence causes insulin deficiency. There are certain medications which can lead to secondary diabetes. These may include steroids, beta blockers, thiazide diuretics, calcineurin inhibitors, for example, tacrolimus, and atypical antipsychotics, for example, olanzapine. Other causes of secondary diabetes includes exocrine disease of pancreas like pancreatitis, glucagonoma, somatostatinoma, subtotal pancreatectomy, cystic fibrosis, and truncal obesity. Cystic fibrosis is a genetic disease in which there is a unique type of diabetes which has features of both type 1 and type 2 diabetes. This is a picture which is showing the secondary causes of diabetes mellitus. Excessive T3 elevates hepatic glucose production, hence thyroid disorders and endocrine disorders can lead to secondary diabetes. Likewise, excessive glucocorticoids increases hepatic glucose production and reduces glucose uptake and utilization. Excessive T3 impairs islet cell function, and pituitary gland releases growth hormone, and the impact of growth hormone and epinephrine is there on glucose regulation, and these are dosage independent. Now the question is, what is fulminant diabetes? Fulminant diabetes is a subtype of type 1 diabetes. The patient presents with DKA, that is diabetic ketoacidosis, with no prior history of diabetes. These patients remain insulin dependent following this abrupt onset of diabetes. And the main cause of fulminant diabetes is acute beta cell destruction, which can be either due to viral infection or due to background of genetic susceptibility. So, intensive insulin therapy is a required lifelong therapy following recovery from diabetic ketoacidosis. Now, the diagnosis and treatment, as well as the clinical presentation of secondary diabetes mellitus, is based on the medical conditions associated, which I have mentioned. and the investigations of the underlying condition and the treatment is according to the cause. So the conclusion of today's topic is the outcome of secondary diabetes depends on the underlying cause. Secondary diabetes is permanent in most cases, but sometimes it is reversible or controlled with medications. Thank you so much for watching. Stay blessed. Allah Hafiz.